From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. My name is John Small and I am your host. And my guest this week is Dr. M.J. Milloy. In 2018, Dr. Milloy became Western Canada's first cannabis science professor at the University of British Columbia, and the first professor in Canada focused on researching the role cannabis can play in the opioid overdose crisis. He is a substance abuse epidemiologist, and his research has focused on the interrelationships between illicit drugs and HIV, as well as the public health impact of cannabis regulation and the medical application of cannabis and cannabinoids. You do a lot, Dr. Milloy. Welcome to the show.
Well, great to be here. Thanks for having me on.
Well, let's talk about who you are and what you do.
Sure.
Tell us about your role at the University of BC as Western Canada's first cannabis science professor. What is that? What is a science professor?
Well, I mean, I should start off by really emphasizing how lucky I am. In 2019, I was appointed the Canopy Growth Professor of Cannabis Science here at the university. And it was really, I think, the culmination of a couple of things, some good and some not so good. The obvious not so good thing is the overdose crisis. And it has really spurred a lot, but probably not enough action among authorities and administrators and people here on the West Coast of Canada. And one of those, I think, was the creation of this new professorship, which I think really builds on a lot of the work that we've been doing to really better understand how people who are at highest risk of dying of overdoses, how they use cannabis and whether or not cannabis might in fact play a beneficial role in this crisis. Obviously, we've been very overwhelmed by COVID, like lots of places. Before and after COVID is this overdose crisis. And unfortunately, it's claiming far too many of our fellow citizens. Every year, it claims an unprecedented number of lives, and really more has to be done, and different things have to be done. And so I'm very lucky to be a part of that, to try and come up with new solutions, to test new solutions, and really to try and improve the health and well-being of people who use drugs.
So what are you finding so far? How can cannabis help in this overdose crisis?
Yeah, I'm the investigator on one of three big studies that have been running here in Vancouver since the mid-90s. And these are funded by the US government, believe it or not. And they really started out to understand the question of, why were so many people who inject drugs here in Vancouver getting HIV? And since then, we've moved on to a lot of other topics, but, really we're using those studies to try and understand the overdose crisis and try and come up with ways of saving lives, of preventing deaths, however that might happen. We started really looking closely at cannabis in sort of about 2015. And full disclosure, when I started my training here in sort of the mid 2000s, I explicitly promised myself I would never work on cannabis because, to be frank, you're working with people who are using heroin and cocaine and all of these really serious and risky substances. I really thought that, who cares about a little THC between friends, right? I was lucky though, in about 2015 to do a study based on some work that we had seen from colleagues down in New Orleans. And they were trying to understand sort of really a very sort of eternal question in HIV, which is if you get HIV, one of the fundamentals is that if you use substances, you're probably going to do worse in terms of your disease than if you don't use substances. And there's a lot of sort of competing explanations as to why that is. I'm really of the mind that people who use drugs aren't treated as well by our clinicians. They don't benefit from the really good treatments that we have around HIV. But some of our colleagues down in New Orleans were really following this idea that something about the drugs themselves causes HIV to be more deadly than people who use substances. And so they started experimenting on monkeys and inoculating the monkeys with the monkey version of HIV and seeing what would happen if they also gave the monkeys substances. And so they gave them heroin, and big surprise, the disease was more pathogenic than if the monkeys weren't getting heroin. Similar with alcohol and also with stimulants. But when they tried it with THC, they found, in fact, that these monkeys did better. The monkeys on THC had less inflammation and they survived longer. And so my supervisor and I, we saw that and we're like, well, this is weird. I wonder what's going on here. And we're fortunate with these studies to have the ability to sort of try these experiments ourselves. And obviously we're not experimenting on humans like our colleagues in New Orleans did on the monkeys. But what we did is we looked at our data, and we found that lo and behold, the people who were using cannabis every day in the year after they became infected with HIV had significantly better viral load than the people who were not using cannabis every day. So it appeared to sort of mirror what these people saw, what our colleagues saw in monkeys. And that was, really my beginning as a cannabis researcher, was that sort of eureka moment that, oh my goodness, THC here might be playing a beneficial role in these people's lives. And so, from then I've, moved on to looking at the overdose crisis. And, we really found again that folks who are using cannabis, it might be playing a beneficial role. How does that work? Well, chronic pain is one of the big reasons why people are using opioids. It's one of the big reasons why people, despite all the warnings, continue to use opioids from the unregulated market, buying opioids from the street, and dying of fentanyl poisoning. But we found, for example, that for the folks in our studies who had chronic pain, if they were using cannabis every day, they're far less likely to use unregulated opioids like heroin and fentanyl. We started testing our participants' urine, and we found that if they had THC in their urine, they were far less likely to have fentanyl in their urine. So a lot of these things were very positive, and we hear from a lot of our participants that cannabis for them is a way to avoid the poison drug supply. It's important to note that fentanyl is in all of the drugs sold on the street. It's in the supplies of cocaine. It's in the supplies of crack. It's in heroin. It's in everything. And this is what's killing people, but it's not in cannabis. So we think that for some folks, cannabis might be a way for them to substitute and avoid that toxic drug supply.
Will they willingly substitute it, or is it something that you have to sort of encourage them to do? Because it's obviously a different experience. I mean, I don't do opioids. I don't do anything with fentanyl, but from what I've heard, it's a different high, different experience.
Oh, yeah.
And does THC replicate that? They're constantly craving that high, right? And does THC replicate that experience in some way that is satisfying to them?
Yeah, well, I think there's a couple things going on. I think you mentioned withdrawal and cravings. And I think for some folks, they are able to use cannabis to get through that period. And in fact, there have been studies done. My colleague Yasmin Hurd out in New York showed that for folks who are in recovery for heroin use, if they are given a very high dose of CBD, they crave heroin and other opioids less than people who are not on CBD. And we hear from our participants that cannabis is a way that they get through that period of withdrawal, not only for opioids, but also crack cocaine as well. We do think that there is intentionality for some folks, and we recently published a study showing that there were a small proportion of people in our studies who told us they were using cannabis explicitly to reduce their frequency of crack cocaine use. And when we looked at the numbers, we in fact found out that this period of intentional substitution preceded significant declines in their reduction of crack cocaine, the frequency of crack cocaine use. So this may indeed show that some people are, successfully using cannabis, THC probably, maybe CBD, as a way of controlling their other drug use. I think pain is a big thing as well, and we all know that cannabis for many people is pain relief. And I really need to really emphasize that pain is why many people in Vancouver and indeed all across North America are dying of fentanyl overdoses, because they live with chronic pain that is not properly addressed through the medical system. And so they turn to cannabis. And we have evidence that if people are using cannabis every day, if they're living with chronic pain, they're far less likely to use unregulated opioids like fentanyl every day. So there's a lot of stuff going on, but we do think that there is enough now for us to try and implement cannabis as a harm reduction intervention or a life-saving intervention to try and help folks who might benefit from it.
So how does that look? How does that intervention look? Let's take the next step here. What does the government do? What do private agencies do to get this cannabis in the hands of the people who really need it, who are at the most at risk of overdosing?
Yeah. Well, you've really hit the nail on the head, right? And that's really what we have, we being me and my colleagues, not only at the university where I work with, but also colleagues in Vancouver and across Canada. That's really what we've been struggling with is how do we take that next step? As you and your listeners, I'm sure are aware, Canada legalized non-medical cannabis in 2018. So now, just like yesterday, I went to my local shop and I bought an eighth of herbal cannabis to celebrate the day, the high holiday.
Yay.
And that's increasingly a regular occurrence for folks here in Canada, which is great. We've had legal medical cannabis for about 20 years, but the system isn't very good. And especially for folks like the folks that I work with who are poor, who are often homeless, who are, really struggling to get by. Unfortunately, both the recreational and the medical cannabis, the legal systems don't work well for them. And we estimate that less than 1% of the people in our studies who use cannabis are getting their cannabis from legal sources, primarily because it's too expensive.
So you have a very similar problem in Canada that we have in America. Yeah.
Yeah. We've seen the same thing in a lot of different places, is that there is a premium for buying from the regulated market, which is too bad, because I think everyone who uses cannabis deserves to use a regulated product, deserves to know what's in their cannabis, deserves to know that it comes from a system in which there's no pesticides added, things of that nature. But unfortunately, the system as it's been established doesn't work for people that we work with. And so we're really trying to struggle to figure out how to get them the sort of the low cost, dependable and predictable products that might, help them avoid the tainted drug supply. Yeah. And so that's
a challenge.
That's sort of the place we're at. There are people in the community who are giving out unregulated cannabis for free as a harm reduction intervention, and they are being raided and shut down and arrested by the police, because the way the legal system is set up, trading in unregulated cannabis is a crime. And one of the big goals of the legal cannabis system that the Prime Minister trumpeted when they announced legalization was to take profits out of the hands of organized crime groups. And I certainly support that, because look, the local Hells Angels don't need more money to pervert our justice system or to corrupt our legal systems. But unfortunately, the efforts to crack down on that organized crime groups have really swept up these community groups, which are trying to do right and which are trying to get free or low cost cannabis to people who really need it. So that's sort of where we're stuck.
Yep.
Between the legal system and the unregulated system. And really, there has not been a space made for harm reduction.
You mentioned that the U.S. government was funding some of the studies that you were, the studies happening in Canada. That's interesting.
Yeah. And then what they're doing is they are funding these 3 large studies of people who use drugs, because since the mid-90s, we've really focused, in some respect, our efforts on studying HIV. And Vancouver has a unique sort of role or place in the history of the HIV pandemic for a lot of different reasons. One of them is that we had the worst outbreak of HIV ever witnessed in the developed world here in Vancouver, starting in the mid-90s. And so the US government and the Canadian government were very interested to figure out why people were getting HIV so rapidly, even though we did have harm reduction and needle exchange and these sorts of systems already in place. And so that really was one of the big reasons why the U.S. government funds these.
Did you find out?
Yes, we did.
What was it? What was it?
Long story short is, in the mid-90s, a lot of folks switched from injecting heroin to injecting cocaine for reasons that we're really not too sure of. But the reality is, if you are injecting heroin every day, you might inject it 3 or 4 times. And so the system as it was set up could handle supplying 3 or 4 clean needles every time to make sure that people weren't reusing and sharing their needles, which of course is the big risk factor for getting HIV. So they switched from injecting heroin to injecting cocaine, and the average cocaine injector might inject 50 times a day, because of course the effects of cocaine wear off much more rapidly than heroin or other opioids. And so all of a sudden, people went from needing 3 or 4 needles a day to upwards of 50. And the system couldn't handle that. And so people really began to share much more often. And add to that the fact that homelessness was increasing. There was a lot more housing instability. There was a big crackdown on people from the police forces. All this sort of added up to a really sort of an environment in which HIV could spread very rapidly. And just like COVID, we've learned that when these environments are created, viruses really take advantage of that. And that's what we saw here in Vancouver. But fortunately, Vancouver is also really well known in the history of HIV for a lot of the things that people have done to try and combat HIV. And so we've seen a lot of advances in harm reduction here in Vancouver for folks who use drugs. We established the first supervised injection facility here in Vancouver, where people who inject drugs can come and under medical supervision, they can use drugs that they've acquired from outside the facility. And this insight, as it's known, has led to a lot of different safe injection sites throughout Vancouver and throughout British Columbia and Canada. And it's helped save the lives of people in the overdose crisis. So Vancouver certainly is an interesting place to do this work. And I think that's one of the reasons why the US government, through the National Institutes of Health, has been interested in funding our work so that we can really try and generate evidence about sort of best practices in this area.
Going back to this subject of cannabis and opioid addiction, people listening to this might think, well, you're just replacing opioids with cannabis. Can't these people who are likely to be addicted just get addicted to cannabis? Aren't you just trading one addiction for another? What do you say to that argument?
Well, you're right. And that's certainly a common argument that we hear. And the response to that would be quite plainly, well, let's keep in mind that fatal overdoses using heroin or fentanyl or another opioid, OxyContin, for example, are very common. And they have robbed families and communities and other places of people for decades. And now it is the leading cause of death among young people, not only here in British Columbia, but indeed in the United States of America. This is an unprecedented public health crisis. We are losing our sons and our daughters, our husbands and wives at an unprecedented rate, and leaving people bereft throughout North America. People cannot die in the same way of a cannabis overdose. So just looking at that level, I think there would be obviously a benefit if people could, in fact, switch their opioid use for cannabis use. But then, of course, there are also a lot of other important reasons around why cannabis, might be beneficial for folks in this situation. Certainly, but before I sort of talk about that, I do want to emphasize that I don't think cannabis is the panacea. Mm-hmm. Certainly, you will find people here in Vancouver who believe THC is a solution to all of life's problems. And as an epidemiologist, I am not one of those. I do believe that substances can be beneficial. I myself benefit from regular exposure to THC and other cannabinoids. But I'm not going to suggest that they don't come as well with risk of harm. And I do know that there are people who suffer from cannabis use disorder and would like to use less or no cannabis in their lives. So I'm not discounting that. But when we look at the balance of benefit and risks of harms, I think it's quite obvious that cannabis is, taken on the whole, less risky than opioids, especially during this current crisis.
So you're obviously very passionate about cannabis. You've made it your life's work. It was very much part of your life's work. Why? Is there a reason? Is there an incident that happened in your life that sparked this interest and belief in the plant?
That's a great question. And to be honest, it's never really been asked of me. I was talking with some colleagues the other day, and we're all the colleagues are drug researchers, and we're all PhDs or professors and all that sort of boring stuff. And we're all cannabis users. And so we were sort of joking, right? There's that old quote from someone, I can't remember who it was, and it was like 20 or 30 years ago, just at the beginning of this idea that you could study cannabis, that cannabis might be something that would be worthwhile to generate more information on. And someone asked the researcher about their own personal cannabis use. And the person's reaction was something along the lines of, well, would you trust my research more if I told you I did use cannabis or I didn't use cannabis? And so we were sort of joking about that. And I can't remember who had the quote, but it's sort of an open secret among many of us who are studying drugs that we are also drug users ourselves. And I hope you've seen the recent book by Carl Hart, who's a neuroscientist at Columbia. I've had the pleasure of meeting Carl and hearing him talk a bunch of times. And he's fantastic. And he's very open about not only his own work around opioids in specific, but the fact that he is also someone who uses opioids himself and not opioids that are prescribed to him, and uses opioids for euphoric reasons, for recreation. And I don't want to use the term come out of the closet because I don't, there are important differences between those sort of things. But I think, his call for us to be honest about our own drug use, honest about our own substance use, I think is really important. Because let's remember that for far too long, the people in the studies that I run and the studies I run, people who many people call drug addicts or drug users or that sort of thing, have been the focus of a tremendous amount of stigma and discrimination. They go to the healthcare providers and they hide the fact that they use substances because they know if they tell their doctors that they use cannabis, they'll be looked on differently,
Right.
and they won't be treated as well. If someone living with pain goes and says, well, I'm using heroin to take the edge off my pain, they won't be prescribed the pain medication they need because they'll be accused of drug seeking. And so I think we have to remember, us in this field have to remember that this is an important dynamic for many of the people that we work with as research participants. And so I hope that by being open about our own drug use, while recognizing that I use drugs with a lot of privilege, I'm not likely to be arrested for my drug use. My child will not be taken away because I tell the wrong person that I use drugs. I have a very privileged life as a drug user, but I think it's important to recognize that my life has been benefited by drug use. Now, maybe that's because I am an inveterate listener of Jerry Garcia and the Grateful Dead, another sort of lifelong problem that I carry. But, cannabis has benefited me. It has provided insights into my own life and into my own existence that I wouldn't have had otherwise. It's something that I like to do at the end of the day, like many other people. So, I'm very fortunate to be able to talk openly about my cannabis use and to be, more importantly, in a field which is very exciting to me intellectually. And so, I got to, recognize my privilege there. And I think, to sort of answer that question that I sort of started the reply with, I think my research has indeed been aided by the fact that I have what we call sort of living experience of cannabis use. And so that's how I sort of come to it. I don't know if I really answered your question all that well.
No, you did. You answered two of my questions because I was going to ask you how cannabis has enhanced your life, and you did explain it. It helps you inner exploration. It helps you relax at the end of the day. How do you most like to consume? Are you a flower? If you're a Grateful Dead guy, you're probably a flower guy.
I'm a flower guy. I started off many years ago when I was sort of 16-year-old smoking what we call up here in Canada BT. I don't know if the same sort of thing happens down south, where essentially it's like you use hash and you burn a bit of hash on the top of a cigarette. You collect that smoke in a typically a broken bottle, and then you inhale that. That was my sort of introduction to cannabis use.
Right.
Listening to the Grateful Dead in the early 90s as with my buddies, but have been fortunate that obviously things have developed. We understand now that burning cannabis comes with risks. I've managed to move past a couple decades long addiction to tobacco, in part thanks to my cannabis use. And so now I'm a flower guy.
You don't do BTs anymore? No more?
I do not do BTs anymore. That would be setting a bad example.
Yes.
And I've never actually used hash in the regulated market, so I don't know how good it is here in Canada. But very fortunate to have a buddy who owns a dispensary, and so he always tells me what flower is really good in the shop, and I use my packs, and that's really how I enjoy it.
Do you find that people who have addiction problems who then turn to cannabis, is there a form of cannabis that they prefer? I mean, a lot of them are injecting, right? So that nobody injects cannabis, right? I mean, I can't imagine. Maybe. Yeah. But is there a form that they like to take cannabis?
That's really a great question, because really one of the things we're trying to do is move from just sort of observational studies where generally we ask people what they're doing and we try and sort of understand things based on what they tell us through surveys and blood tests and that kind of stuff. And what we're really doing now is trying to do controlled trials, clinical trials. And in part, that's because of the professorship that I hold through Canopy Growth. It was really the mandate to sort of try and advance science by doing the sort of controlled trials, because that's really what folks who are regulators, who are running the medical system, running the healthcare system, that's really the kind of evidence that they need to sort of better understand and sort of better regulate cannabis in our healthcare system. So we're really trying to do controlled trials, stuff where we give people either cannabis or a placebo and see what happens. And to do that, we're really trying to understand what forms would be best. And to be honest, we don't have, we haven't really come up with, this is it, right? Let's give everyone joints of this kind of kush, or let's give everyone, sativa really seems to be sort of scratching everyone's itch here, who are using it for this sort of purpose. So there's a tremendous amount of variety. We have heard from a lot of people that edibles are really, what they look to, just because the sort of the relief, especially from pain and withdrawal, seems to be much longer lasting.
Yeah.
Whereas they'll turn to flower to really address those sort of breakthrough pain or breakthrough cravings. They'll take a joint, or they'll take an e-cig with THC oil, and they'll use it for that sort of short-term relief. But that's what we're trying to do, is we're really trying to sort of learn from the folks who are doing it, who are getting by, who are surviving this unprecedented overdose crisis every day with cannabis. We're trying to learn from them so that we can try and replicate their strategies in a sort of a, much more formal scientific environment to sort of generate the evidence to see what works and what the benefits and risks might be.
Dr. Milloy, this has been really interesting, and thank you for all the work you're doing. And I look forward to hearing more about your research.
Well, thanks very much. It's been a great chance to chat about my research and about the Grateful Dead, which I always love. And we're.
So have you ever listened to the Grateful Dead high and then not high?
Yes.
And then not high? Have you ever compared? I mean, is it the kind of music that really there's something about their music that that it helps to have a little bit of THC in your system? I wonder why so many people who are Deadheads or Fish fans smoke herb.
I would love to do it. I would love to
be a great, interesting study
to do that sort of study. I would love to do that. I read a piece in the LA Times actually yesterday about the guys who came up with 420. I guess they call themselves the Waldos.
The Waldos. I had them on the show.
And I wasn't surprised to learn that the Dead played a role in their lives as well. And something struck me. They talked about how cannabis use for them in their view, cannabis, the scene is different now. And when they went to Dead shows or when they used cannabis before legalization, it was all about kindness and gratefulness and being kind, and there's a real history of that in the Dead scene, which really, the first time I went to a Dead show, being sort of enveloped in that kindness was something that was very profound for me. And really, there were a lot of parallels I felt with cannabis use and that sort of feeling that you get when you're using herb with others. So I don't know. Again, I'm sort of meandering.
No.
And I'm not sure what the relationship is between the Dead and cannabis, but I would love to do more of those stories to try and get at,
next,
the role
next time we'll bring you back and talk about the Dead and cannabis. And I'm going to send I'm going to send us out with a Grateful Dead song here. Thank you so much again for joining us, Dr. Milloy.
My pleasure. Thanks.
Enhance Your Life is brought to you by Wana, the #1 infused product in North America. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, head on over to wanabrands.com. That's Wana, W-A-N-A, brands.com.